Hi, thanks for joining us today for BRMC's Healthy Connections with our special guest, Lori King McCracken, and she is here representing First Step. Lori, first of all, please tell our viewers what First Step is.
First Step is a medical stabilization service for those who have become dependent on pain medication, alcohol, some street drugs, typically lasting 3 nights, 4 days in the hospital. Their withdrawal symptoms are treated by a hospitalist at the hospital.
And for those that may not be aware, a hospitalist is a specialized physician who takes care of another physician's patients while they're in the hospital under normal circumstances, but the hospitalist group that we've contracted with at BRMC in fact also take care of all of the First Step patients because they're right there in the hospital. Correct on that? Yeah. Okay. So, and this is what year is this? This is 3rd year, 4th year?
We are going on our 5th year.
Wow.
We started in 08.
Okay.
In 08.
Yep.
And I think it was September of 08. So
by the time we,
so yes.
It's coming up on the 8th year. That's wonderful.
And it's flown.
Yeah.
Flown by.
I know that we've talked in the past about how it continues to grow and grow and grow. And do you have a specific number of beds that are designated for folks that are coming in to go through their...
We don't have a designated number. The hospital has been very gracious to us to allow as many patients that need this service. We will find a space for these patients. We typically utilize the 4th floor and the 5th floor because those nurses are specially trained to deal with this type of care. But as far as a number of beds, the hospital has, like I said, graciously given us as many beds as we need.
And you'd mentioned the word withdrawal, just kind of to focus on that a little bit. This is not an end-all to be-all 3-day program and you'll be fine. This is just to get people stabilized.
Right. We don't have the magic wand, which we wish we did.
Yeah.
But this is a service that makes sure the patient is safe. We safely withdraw them. We treat their symptoms because when a patient does withdraw, there are risk factors.
So in other words, if someone is withdrawing and they start sweating profusely or start to feel nauseous, that can be treated medically.
And those are typical withdrawal symptoms, more like feeling like the flu, the nausea, the vomiting, tremors, restlessness, achy.
Yeah.
So we have medicine, non-addicting, that helps treat those symptoms.
Okay. So that so you're not trading one drug for another, of course.
And we do monitor blood pressures and make sure the patient
is safe,
free of seizures, and and just safe.
And who do you see typically? There's always such a stigmatism around, as though it's a weakness, or for instance, someone has a surgery or an accident of some sort and they're put on pain medications and then find that it's really hard because the pain medication does just that. It controls the pain, and it's that vicious cycle of taking more to control it, and the next thing you know, you're hooked on your pain medication. I would think that would be for any age.
For any age. And I don't think anyone intentionally goes out to have the drink or to take the pain medication to intentionally become addicted. I don't think anyone does that. Some people, yes, they do recreational use, but I don't think they ever intentionally do it to become addicted because there's so many risk factors. It's not all fun and games when you do become dependent on any kind of substance. But we do see, I'm not going to say, well, more of our older population seems like they become dependent on pain medication because their physician has prescribe them pain for, arthritis or, and the patient just becomes dependent. Their body just gets adjusted because they're used to that daily routine of taking that pain medication. The individual maybe forgets to take it at that exact time or just decides, I don't want to take it today. And then their body starts having a physical reaction because it's thinking, where's that food? I haven't had it yet.
Yeah.
And
we talked earlier during the break, and the only thing I can even come close to equating it with is I've always been a coffee drinker, and a couple of times in my life surgeries that didn't allow for you to have coffee. And oh my goodness, the headache that comes along when you withdraw, because you can become addicted, I believe, to anything.
I think so,
aspirin,
too.
Anything. But boy, I'll tell you, without those cups of coffee that I normally have every morning, my head was pounding.
Yes.
So those are things that we all want to be cautious of too. So and to maybe have a little more compassion for those that are going through these programs.
Right.
Now, I think one of the criteria that you have for this is that the patient has to be absolutely willing
to come. Yes, the patient has to be 100% on board.
This is not an intervention where the family has said, okay, you're now going to the hospital, you have no say in the matter, that's it.
Right, and we do, that is one of the requirements, that we do have to talk to the patient. Because, you know, family members and friends and spouses, of course they want to help and they want to call and put their 2 cents in, but it's ultimately up to the patient to be willing to come. It's not going to do anyone any good if the patient is not on board. And they know themselves the best, so when we are able to ask those personal questions, history questions, they can give us the best answers.
Right, and it's their behavior that has to be changed, not their family member, not their spouse. Yeah.
But if the spouse or the friend or whoever does have concern and their loved one is not ready, they can call us. We do have support groups such as Al-Anon that we can give those phone numbers out so they can be seeking help for themselves until their loved one is ready.
Can you give out your number now? We'll do that again at the end of the show, but for those that are tuned in right now, what's the number they can reach you at?
Our number is 870-508-7590.
7590, okay. Because this is the time of year.
It's stressful.
Yeah.
It's the holiday season.
And if that's the kind of thing, if it's...
New Year's resolutions coming up.
Sure, and especially with drinking, if it's stressful, that kind of thing. There's so many holiday parties and alcohol is served, and you just go a little bit further than you thought.
Well, and just the stress of the financial piece of Christmas in the holidays. There's lots of things to prepare for.
Sure. Where are you seeing people come from?
It seems like this month they've just, they've been everywhere. We actually had a patient from St. Louis, Missouri come. So we see residents from the Missouri area as well as Arkansas.
Those 2 states. Anything further than those 2 states?
We do see patients from Oklahoma.
Okay. The reason I'm asking, you mentioned first initially that stigmatism that's there, that people often feel that the problem is solely theirs, that it's not something that's medical, that if they were stronger, that you know, they could overcome this kind of thing, when in fact it's their body that's gotten addicted to this, and here's a way out. So I would think it kind of makes sense that you've got people from out of state coming in. It's 3 days. I mean, if they're going to live a lie, they can say, okay, I'm going on a little vacation, a little fishing vacation or a hunting vacation, when in fact they check themselves into the hospital. So
yes, and that's what a lot of people like to do. They like to do the Friday over the weekend, so they're not missing
too much work.
Yeah. Their kids,
it's easy to explain.
It is.
Yeah.
It is.
Because it does. It makes people, I'm sure, that they just don't feel good about themselves.
They feel like they've done something wrong.
Yeah.
When, like I said before, I don't think anyone ever intentionally becomes addicted to these substances.
And you said the nurses are special trained, so there's no judgment. They're just taking care of a sick patient.
Right.
So, which is wonderful, how it should be, and we're glad to hear that. What else can you tell us about the program? What's now, is it going to be expanded in the new year?
Well, of course, we always have our ideas, and we would love to be able to expand. Nothing yet, but we always do toss those.
Yeah, and you travel everywhere, don't you?
You
do the marketing piece for First Step, so you're out and about.
All over Arkansas, and then Missouri. Okay. But I go about as far as Houston, Missouri to Springfield.
Okay. All right, and you're stopping in where? You're stopping in at hospitals, clinics?
Hospitals, emergency rooms.
Sure, they would be great.
Counselors' offices, social work. Anywhere that I feel is a place that someone might go there for help. But mainly doctors' offices.
Have the churches done anything to reach out a little bit? I'm always wondering.
There are a couple churches in this area that have reached out and have sent us patients. I have visited every church in Mountain Home. Now, it was in the beginning.
There may be new churches since you started out.
Yes, there could be new churches.
Because this is something. It has nothing to do with your economic status.
No.
It has nothing to do with anything other than you just happen to be a person that's become addicted to a particular substance of some sort. So those are all things that we need to know. So, Lori, we need to talk some more, especially with the holidays right around the corner. But we need to take a short break, and we'll be right back with you. We're with Lori, and she's talking about First Step, a program that's at the hospital that you may want to share with a loved one, especially when you're getting together at the holiday time and notice that there's a need. We'll be right back.